Testing, testing, 1, 2, 1, 2, 1, 2. on them because I'm like, oh,
Which camera is it?
You're on this one. Good evening. My name is Oseye Boyd, Public Engagement Editor for the Indy Star. We're talking bills, bills, bills tonight as we wrap up the 2023 session of the Indiana General Assembly. The session, which began on January 9th, ends next week. It's been a busy few months, for sure. This is a budget year, so Indiana lawmakers have decided how to spend your tax dollars for the next 2 years. Joining me this evening to discuss some of the bills that have passed and will become law, some that didn't pass, and what caused controversy at the Statehouse this year is Statehouse and politics reporter Kayla Dwyer. Welcome, Kayla.
Thank you.
Thank you so much for taking time out of your busy schedule. I know there's a lot going on. I know there's a lot. The clock is ticking. We're down to the final count almost, so I know it's ramping up over there to get those bills. They're probably just flying past you left and right, just whizzing. Pew.
They are, and they do so much behind closed doors that it really does whiz by when it comes to the public stuff.
And we're going to get into some of that behind closed door stuff. We want to know. But let's start with the budget. Where are we at with budget negotiations? What's the economic forecast for Indiana?
So, as many of you readers and watchers probably know, at the beginning of this year, the governor puts out what he wants to see in the budget, and then a few months later, the House put out what they think should happen, and it's, they take what the governor gave them and they make their own changes to it. And then the Senate comes out with what they think, their tweaks, again, to this overall vision. And that's sort of what just happened last week.
Okay.
So the Senate's version follows the governor's version a little bit more closely than the House does. And where we're at now, actually the conference committee is what they call it for bills where there's disagreement over where they should finally land. All that stuff started this week, including with the budget. So actually, just this morning, there was the budget conference committee that met. They had a couple more minutes of public testimony over, I really wish you would consider funding this thing more and that thing more in your final negotiations. But what's going to happen over the next, 10 days? I probably should know the actual day number. But
we
over
don't
the
know
next
numbers.
week
We don't know numbers.
is, lawmakers, and they were there until apparently 11 p.m. last night, caucusing and talking and hammering down those final details over some of the points of disagreement.
I like how you said that.
Yeah, so, that's something we're not going to see the results of until next week. Which day next week? No clue.
So this late in the process, it sounds like they're really just getting going.
Yes and no.
Okay.
They agree on a lot.
Okay.
Because we have a supermajority in both chambers of the Indiana legislature of the same party. So a lot of behind closed doors, they've already come to an agreement on a lot of things in the budget, including how big it should be. And we just got updated revenue forecast. Every budget cycle, the same thing happens. They give a forecast, the state budget agency gives a forecast in December and in April of where they think state revenues are going to come in. That includes your state income tax, sales taxes, things like that. They do need to get that April forecast before they can feel comfortable finalizing the budget anyway. That came in better than expected.
Okay.
It came in with an extra $1.5 billion of wiggle room for them to work with. So now they have to, $1.5 billion more than the December prediction, I should say. So now they have to decide what's going to get more money, or is that just going to go into the savings bank?
Into a rainy day fund.
Or are they going to fund mental health more, which all indications are that there's a lot of support for putting more dollars toward reinventing the state's mental health system. I can tell you more about that if you want, but anyway, but it does seem like a lot happens last minute, and that's also true. I mean, there's a little bit of procrastinating going on, and naturally so. We have a a deadline of next week, and these are the biggest ticket issues. This is how we're spending taxpayer dollars. So in some sense, you want to hope that they are, continuing to hammer it down until the last minute
That's
that they
true.
can, right?
Have there been any surprises?
A few. I think we know that there's disagreement between the House and Senate on how much to spend on private school vouchers. We know that there's a little bit of fluctuation on how quickly to speed up income tax cuts. But what did pop out, particularly in the Senate proposal for me, was I didn't expect to see this proposal to divert several $1 million from the Department of Child Services into a pilot program to contract private attorneys instead of DCS's in-house attorneys to handle child abuse cases. This is something that caught child welfare advocates off guard. It would seem to be the beginning stages of the privatization of legal services within DCS. So that's something that we're looking at. And also something that popped up that I was interested to see that was sort of the resurfacing of a previously dead Senate bill was a proposal to have charter schools share in some of the property tax increases that public schools usually would reap the benefit of. So I think it'll be interesting to see if that stays in the budget.
Whew. There's just so much, and we're just getting started.
Yeah.
So as I said, we're getting down to the wire to pass these bills. What's the holdup for some of the bills? Are legislators still wrangling out some of the issues, wrangling about some of the issues? Do you see any last-minute concessions, amendments to some of these to get them passed?
I think the biggest things we're seeing a holdup on are the big priority bills for Republicans, including the health care, the bills that are trying to deal with healthcare costs. Those are some of the biggest bills that have had a lot of controversy as well, because hospitals feel like they're being targeted as like the group that lawmakers are pinning as responsible for controlling the cost of healthcare, whereas there's a lot of other players in that mix. There's insurance, there's pharmacies, et cetera. So there's been a lot of debate throughout the session that's still actively going on, and probably will to the last minute, over how exactly should we shape those various bills that are targeting healthcare costs, and who should bear the brunt of that responsibility. Also, property tax relief. You all probably got your bills in the mail.
Yes. I was just thinking about that. My bill just came this week.
That is also going to be something that takes us to the bitter end, because there's a balancing act between relief for homeowners and the cost that would bear for local governments who collect that revenue, right? So that's been a delicate balancing act. There have been very large bills dealing with that have been like a House Bill 1499, I think it is, that was totally stripped out, and now Chairman Thompson, the chairman of the Ways and Means Committee, is talking about how, you know what, we're probably going to bring some of that back, and the Senate leaders are very confident that we will end up with several significant provisions for property tax relief. But what exactly those are, we just don't know yet.
Seems like we're always doing property tax relief. So where are these disputes playing out?
So because we live in a supermajority state ruled by one party, that what that means for democracy is there's less public debate about a lot of issues. A lot of where these issues are going to end up gets decided behind closed doors in caucus rooms. Over bills that there's disagreement between the House and Senate, we have what are called conference committees, and there are both Republicans and Democrats appointed to lead these conference committees. That's where they're supposed to hammer out the differences between the House and the Senate versions of bills. However, oftentimes these committees convene as a formality, and there's no rules per se over how much they have to divulge in the public portion of that meeting. A lot of where they end up at just gets decided in caucus. We've seen in the past, and I'm sure we'll see again, if it seems like the Democrats on the committee are not coming into line with what the Republicans want, the chair will just decide to replace the Democrats on the committee. Chairs have a lot of power in our legislature, and they can sort of suspend rules as they see fit. There's a lot of leeway when you have
That's
a big
very
supermajority.
interesting. Mm-hmm. That is very interesting, and I think most people probably don't know this kind of inner shenanigans, if you will, that is happening. Like,
yeah,
I wouldn't know that that's what's going on.
It for a journalist, it makes for a lot of playing catch up sometimes.
And running from room to room to room.
Running from room to room, chasing down lawmakers in the hallway. Yeah, all that jazz.
So in July 2022, the Governor's Public Health Commission recommended Indiana spend an additional $242 million on public health each year. Some lawmakers scoffed at that number. Governor Holcomb revised the ask to $120 million the first year and $227 million the second year. Will Governor Holcomb's plan come to fruition, his initiative come to fruition?
As it was intended, probably not.
That doesn't sound good.
Because this is one thing the House and the Senate are in agreement on, is wanting to fund about half of what that commission had asked for.
Okay.
So both of their budget proposals land on 75 the first year, 150 the second year, which is 225 total. When you look at what the commission originally recommended, it was 440 total over the 2 years. That's half. And I mean, those commission authors have told us in the past, if you undercut this spending, there's no guarantee that we'll achieve the goals. Mm-hmm. The way that they arrived at those numbers was they took what Indiana spends on public health per person, which is $55 per person, which puts us 45th in the nation. And then they took the national average, which is $91, and they took the difference, $36. Is that right? Anyway.
It's math. I don't know.
Multiplied by our population, that's how they arrived at their number. So, if we don't do that full number, we're not coming up to even the national average for public health spending. So, counties will be, the number that we're seeing in this budget, all indications are it's not going to change. It's going to remain at that level. Counties will have the option to opt in to get more funding. Certainly they'll be able to do more, but will they be able to do what Governor Holcomb hoped they could? Probably not. And the reason for that, there was a lot of concern expressed as this bill moved through the process. There were concerns over, having too much state involvement or control over local county health departments. That's kind of a post-pandemic trend. Mm-hmm. A lot of distrust in mm-hmm. big government. Mm-hmm. So people wanting to trust the local people that they know above all. Mm-hmm. Mm-hmm. So that's where that sentiment comes from, and that's where a lot of lawmakers have pause over the whole thing, the concept of the whole thing.
So, if the money that they want to give is approved, we could still remain 45th in the country.
Maybe we'd notch up a little bit. It's certainly a record infusion, a really large infusion, but it wouldn't bring us up to that national average that we hoped to be at.
And when we talk about public health, what does that entail, just quickly?
So the vision was so right now, public health is delivered by county health departments, 95 of them, and there's no cohesive standards or there's no coordination among counties. It's a very localized system, and the vision is to have a little bit more of a state-local partnership and agree on standards of public health provisions, like programs to help people quit smoking, things mm-hmm, like that your mm-hmm. county does for you. So, yeah.
Okay, thank you. So we have this recurring theme, this theme of parents' rights emerged recently in the last few years. And while we didn't hear much about critical race theory this legislative session, We did hear about bills that are talking about banning books and jail time for educators. Where does legislation stand on those issues now?
So let me start with jail time for educators, because it sounds alarming.
Yes, it does.
So that the specifics of that were in a Senate bill that had a low number on it, meaning it was a high priority, but it
A low number means high priority.
typically,
Okay.
yeah, like
Okay.
Senate Bill 1, 2,
Oh,
3.
okay,
Yeah,
okay.
yeah.
Numbers.
Yeah, sorry, too many numbers today. But anyway, so it was a bill saying that the existing law that protects schools, like K-12 schools, from like gives them sort of certain legal protection against wanton lawsuits about harmful materials. It would wash away that legal protection. So, people accused or found guilty of disseminating harmful materials could get a felony charge, and of course that involves jail time. So, what are harmful materials? That's the whole debate, right? And how much should what kind of process should we put in place for parents to be able to allege these things? And that's where parental rights comes into play. Provisions in that bill technically died. It didn't pass out of a committee by the deadline that it was supposed to. But the way things work in this session is, if anything has moved through one chamber at least, and this provision has, it can resurface at any point in one of these conference committees.
Okay.
That's another interesting tidbit. Amendments to bills. They can just pop up. Some committees are more strict than others about germaneness. Does it have to be related to the topic of the bill? That just depends.
Is that why you see sometimes a bill that's passed has some weird amendment in it and you're like, where did that come from?
Yeah, that happens all the time. So we've been told by House leadership that they intend to put the book stuff, library book stuff, into some other bill. We don't know where yet, but there was also parental rights discussion around the use of pronouns in schools, or names or pronouns that differ from what you were born with or what's on your birth certificate. And should parents be notified, or should their consent be obtained before a kid can be called by what they want to be called? That is, again, it wasn't something that has passed through the traditional way, but very well could surface again in conference. Of course, parental consent came up again with 480, the healthcare ban.
Yes.
And that's been signed by the governor. That's a law now.
Okay, because that's where I was going in that same vein. We see a lot of these bills that seem to target transgender youth, and so it's like the topic du jour right now. Instead of CRT, is transgender this session.
Yeah.
And this brings me to my next question. While some of our more controversial bills, such as those bills, have our attention, some bills are just as important, or maybe even more so, but they're missed. They're not on our radar because we have these, like I said, the topic du jour that gets all the attention. Are there any bills that we should be concerned about that didn't get as much attention?
Yes, I think something that's gone under the radar a little bit, and actually my colleague Kate, I know, is going to work on a story about it. There's a bill about absentee voting, trying to require identification for being able to vote absentee. Right now, of course, we do have a voter ID law for voting in person in Indiana, but this would extend it to voting by mail. And there's some provisions in the bill that, if you make a mistake in your application in terms of your identification number, county clerk would have to come see you in person and give you a new application, and
they would come to you, or you have to go to them.
In theory, they would have to go to you.
That's a lot.
So I think there's going to be, questions about an undue burden with that. I think we'll have to keep an eye on that. Constitutional right to bail is a biggie that I think was discussed quite a bit earlier in session. I think maybe has dropped behind the radar. Lawmakers are proposing an amendment to our Constitution, and this will have to go through 2 general assemblies and a voter referendum before it's real. But it's already on its way through the
Yes.
first one. You know, we would become one of the more vague states with regard to when bail can be withheld from you. Right now, it's only for murder or treason. Under the constitutional amendment, it would be that, or if a judge decides that with evidence, and what constitutes that evidence, I'm not sure, but with evidence that you are deemed a danger to society or to the people around you. What kind of danger? That's a good question too. Anyway, so that's something that I think we'll be taking a closer look at as well. And one last quick thing too that you might notice on your shelves in the pharmacies. There's again, this was snuck into another bill via an amendment, so it kind of snuck up on us, but an attempt to make those ready-to-drink cold mixed beverages like a High Noon or
I don't know what a High Noon
vodka, like a Moscow
frozen?
Mule.
Okay.
You know, they're cold, they're in a can, you know, ready to drink.
Oh, the in a can. Drinks.
Yeah.
Okay, like the little cocktail. Okay.
Yes, exactly.
Yes.
To make those, to make it so that only liquor stores can sell them. So you wouldn't be able to find them in your CVS
At the grocery
or
stores.
grocery store.
Yeah. Okay.
So that's an interesting development in the liquor wars in Indiana.
The liquor wars.
We could do a
We
whole
could
episode
spend a
about
whole
that.
a whole show on the liquor wars in Indiana because it's always interesting
Yeah.
on what lobbyists want you to be able to sell and not sell, who can sell it when and where. Because what we just started being able to buy liquor on Sundays.
Yeah.
What, 2, 3, 4, 5 years ago, something
Not
like that?
long ago. Yeah.
Yeah. So
I also think ratepayers should look at my colleague Sarah Bowman's reporting on various utility bills because, you know, we have a big electrification wave coming via federal, you know, this federal push to electrify the country. And with that, you know, we need more transmission lines, we need a better grid. And with that comes, well, who pays for that beefed up capability? You know, so and who gets those contracts? You know, so there's some pretty big bills that are dealing with that as well that Sarah is much more knowledgeable about.
Well, you mentioned mental health a little bit ago, so I wanted to kind of revisit that quickly.
Yeah.
So we're talking about how we can do that better in Indiana. Are we really seriously going to do that better? Are we putting money behind it, or is it just kind of talking and arguing about it right now?
That I have the most hope for, and a lot of people do. The whole idea is the state has 24, like 24 or so community mental health clinics.
Okay.
These are these separate, you know, clinics where you can go, you can get services, you know, if you're in distress and see a counselor, all these things. We also now have a 988 suicide hotline. Not even just suicide, if you're just having mental distress and you need someone to talk to, you can call that phone number, just 988 hotline. What we don't have is a lot of coordination between those pieces. So the idea that Senator Michael Crider in particular is sort of championing this, and there was a behavioral health commission that put together this report last year to sort of put a dollar figure on how can we make our system so that you can call and someone can respond to you and with services. It's not just like you have someone to call and you can just talk to them and then you're at home and what do? You can call, someone can respond to you. There's these mobile crisis teams that can be dispatched. We want to make our community health clinics into more beefed up version of themselves. It's called Certified Community Behavioral Health Clinic. It's just a fancy title that means they can get federal funding. But in order to become that, you need to meet certain requirements, and they need money to do that.
Okay.
That's the simplest way I can explain it because it's kind of complicated. But anyway, the request from the Behavioral Health Commission was, we need $130 million to make all of this happen, this vision come true. At first, the Senate budget simply funded $35 million, and to be fair, Michael Crider only asked for $30 million. But there's definitely discussions, and especially now that we have this rosier economic picture from the forecast, the extra 1.5 billion to work with, lawmakers are very confident that they'll come to some sort of agreement on an additional funding source to pump in more dollars, whether that's something the commission has recommended is a surcharge on phone bills, like a $1, like 911 already has a $1 surcharge.
Yes.
That's how we pay for 911. Same thing with 988, that would bring in $90 million a year. That's almost your whole ask right there, in addition to the 35 that they already allocated. There's been talks of a cigarette tax. The House Republicans seem interested in that. So it seems like they will land on something.
So if you still smoke, you probably need to stop. Because don't they already tax cigarettes? I have no idea.
Not sure. I know like instituting or raising the cigarette tax has been a topic that the legislature previously hasn't really wanted to touch that much. But they're willing to for this.
Okay. Well, that's one good thing out of the pandemic, though. We have we talked about some other things that have been kind of controversial, but this is a good thing.
Yes.
We are now talking about mental health in a much more productive, and actually not just talking about it, but trying to actually do things to help people.
Yes.
So I do think the pandemic really, really helped us in that respect.
And this is unanimous. Everyone's behind this.
Yeah. Well, we had legislation fail, obviously. What legislation fail do you expect to see come back in 2024?
Well, the problem is even the stuff that has failed could still come back
this year.
So it's hard to say, but when I think of 2024, I think of a continuation of trying to solve the healthcare cost issue, because there's things that they put forward this year that they've since reined in. Like, for example, banning non-compete clauses for all physicians. They're limiting it now to just primary care, but maybe next year we'll see it spread further. You know, maybe this is a stepping stone. An initial version of a House bill trying to deal with healthcare costs would have instituted I don't know if pretty severe is the right word, but significant penalties for hospitals who didn't bring their costs in line with national averages. Those penalties went away, and I think, you know, as we continue to study what are the best ways to reduce costs in this system, we should hopefully see more legislation to that effect next year. Also, on the social front, I think a trend we're seeing in a lot of states is the localization of national politics, right? So maybe there's things, and you know, the transgender legislation has been, we've seen those bills in many other states, virtually identical language, and I think, you know, it's not out of the realm of possibility to see things that we've seen in other states migrate their way here. Okay. I mean, other states have talked about social media regulation, right? We haven't talked about that yet, but that's in the national conversation. Maybe that could make their way to Indiana. Who knows?
Who knows? At this point, who knows? Who knows what we could see? I have one last question for you, though. This is your first year covering the whole legislative process.
Indeed.
I think first month, right?
Yes.
First
well,
full month?
By myself anyway.
Yes, by yourself. Seeing it up close daily, what did you learn, or were you surprised by something? How the sausage is made, you got to see that.
Yeah, you know, I think I'm about to sneeze. Nope. Oh, it's not coming. Okay. Whew.
Just move through. Just move through.
Allergy season. You know, I knew just from living here and talking to my colleagues that, you know, a lot of decisions get made behind closed doors, like we already talked about. But seeing for myself how that plays out when you get to the floor of the House or Senate has been really interesting, because it's like all it takes for the entire supermajority to hop onto something or agree with something is just for one of their colleagues to put their name on it. It doesn't seem like there's much discourse over, or at least not publicly, over the merits of said thing. It's just there's a go along to get along, and that's been really interesting to see. And anything, almost anything that like amendments to the budget bill, for example, that a Democrat proposes is just an automatic no for almost all the Republicans. There's a handful that break with the
Poor
party, but if it's such a big supermajority that none of the moderates would make a difference in the vote count when they break the other way. So how entrenched that is has been really interesting to observe in real time, and also how much power committee chairs have. That's pretty. I'm understanding that it's somewhat unique, our state,
Really?
in terms of how powerful they are. Yeah. So, anyway.
Well, I just want to thank you so much for coming.
Yeah.
And joining me and talking about legislation that's happening. And still a few more days. Like you said, we have a few more days. You've only been doing this for like a month or so by yourself. You've had a busy month. You've learned a lot.
I've learned a lot. Yes.
And you're doing an amazing job.
Thank you.
And I know you're probably going to take some time off to just like decompress.
Yep.
Once it's done.
I'm gone first week of May. Sorry, primaries.
Well, thank you so much. And thank you everyone for watching, and have a good night.